You're listening to Health Professional Radio with Wayne Buckler. Joining me today is Gary Jankelowitz, Medical Director with MSD for Australia and New Zealand. Gary, welcome to Health Professional Radio.
Thank you, Wayne. It's good to join you. As you said, I'm the Medical Director for MSD in Australia and New Zealand. MSD is part of a global pharmaceutical company. We named or trade as Merck & Company in North America, and everywhere outside of the U.S. We're regarded as MSD.
And given that it is a global brand and very well known, I think most of our audience, being clinicians of one sort or another, will recognise it and will be pricking up their ears now to hear what you've got to say, Gary. Gary, tell us what it is that's been taking your attention with MSD. What's been your focus recently?
I think, as your audience may know, Merck MSD has been around for a long time, I think over 150 years, and we're an innovative pharmaceutical company. We're involved in the discovery and development of medications in multiple therapy areas. We have an existing portfolio of products which are set in various therapy areas, and we also have a range of areas which we're investing in R&D in terms of clinical trials and development in new therapy areas.
Gary, which of those disease areas have been front of mind for you?
So MSD is obviously very involved in, as I said, a range of different disease and therapy areas. Important to us would be type 2 diabetes in the primary care space, as well as the management of cholesterol and the management of blood pressure. We also have a focus on vaccines. We have a range of both pediatric and adult vaccines. I think many on this station will be aware of the human papillomavirus vaccine. So Merck and MSD in Australia partner with CSL in bringing the human papillomavirus to the marketplace here. We also have some interesting new vaccines coming. For example, we have a vaccine which will be used to manage shingles for the prevention of herpes zoster. And then in addition to that, we have a range of acute care hospital products in the fertility area. We also focused on HIV, hepatitis C, and anesthesia. And then finally, the final focus area for us is oncology. And this is probably the most exciting area for us at the moment. We have an immuno-oncology agent. So anybody who is currently familiar with the general management of cancer, you would usually use a mix of surgery, radiation, and chemotherapy. But the new area, and the area which is a big focus for MSD, is immunotherapy, where we really use the body's own immune system to fight the cancer. We've recently had approval in the US and Europe and in Australia for an immunotherapy agent for the treatment of melanoma. That's for advanced metastatic unresectable melanoma. And the same immunotherapy agent which we're using, we're currently now running clinical trials in 40 different tumors. So a very, very exciting area, and an area which is really going to probably change prognosis and outcomes for individuals with some of these very difficult to treat cancers.
And Gary, that immunotherapy that you're talking about, that's not a preventive vaccine, that's actually a treatment?
No, this is not a preventive vaccine. It's a monoclonal antibody. Effectively, what the agent does is, on your cancer cells, you produce a marker which signals to your body's own immune system that the cancer is not foreign, and that the immune system, your T cells, should leave the cancer alone. What this what this drug does is it effectively binds to that and blocks that inhibitory signal, and you now have an immune system which suddenly recognizes the cancer as foreign and uses your own body's immune system to fight that cancer. And for example, in the area where we now have registration and reimbursement in Australia, the area of metastatic melanoma, previously cure rates less than 25% 1 year survival. With this agent, we're having 70 to 74% survival at 2 years. So significantly changing the outcome and the prognosis of patients with metastatic melanoma.
That is a spectacular result, isn't it?
Yes, very, very exciting. And as I said, the company is now focusing, we invest as a global organization about $6.5 billion in clinical development, and we're diverting about 50% of that now to focus purely on oncology and immuno-oncology specifically.
That is a very significant investment, and if the melanoma agent you've been talking about is any indication, I think that will have huge ramifications for lots of people, which is very good news indeed. When you were talking previously about the HPV vaccine, and you mentioned herpes zoster as a vaccine, is that using the same technology? Are they related in their technological route?
No, not at all. I mean, that's a vaccine similar to other vaccines, so a different mechanism.
And again, for anyone who's ever had to nurse someone with shingles or had it in the family, or indeed suffered it themselves, it's a vaccine that you would immediately go, thank heavens for that.
Yeah, so it's interesting because, as you know, in a market like Australia and New Zealand, we need to demonstrate to the regulatory agency that the product is safe and effective, and then we need to demonstrate to the reimbursement agency that the product is value for money over the current standard of care. So something like a vaccine for shingles has been approved in the Australian marketplace and will join the National Immunisation Program during 2016. And that's for individuals between the ages of 70 and 79.
You're listening to Health Professional Radio. My name is Wayne Buckler, and we've been in discussion with Gary Jankelowitz, who's the Medical Director for Australia and New Zealand for MSD. And Gary's been sharing with us some of the research outcomes and the therapies that we can expect to see in the future coming through MSD. Gary, what is it that occupies you as the biggest misconception in your industry? I mean, in all industries there are misconceptions, and I guess yours is no different. What's the biggest misconception amongst your customers, clients and patients that drives you nuts and keeps you awake at night?
I think the biggest issue facing us as an industry is the speed at which we can get our products to patients. As you know, we invest a significant amount of money and time in R&D to show that our products are safe and effective and add value. The issue, or the thing that really keeps us awake at night, is the amount of time which it takes to get those products from phase 3 clinical trials to be able to be used in a way that all individuals, even those outside of clinical trials, can benefit from them. You know, the average time from completion of a clinical trial can be anywhere between 3 to 5 years once we've got registration and follow the reimbursement process. So, we're really making every effort to try find ways in which we can work with both the regulatory and reimbursement agencies to expedite review of our products so that we can get our drugs to those patients who need them most.
I can certainly understand why that's a misconception that would keep you awake, Gary, and today with a little bit of luck, we will have dispelled some of that misconception amongst our listeners. I'm not sure we have too many people in the regulatory area listening to us, but maybe they'll hear the appeal as well.
I mean, it's interesting because in the US, what the FDA, for example, has now introduced is an expedited review. If you have an area of significant unmet clinical need, for example, an area of cancer or a severe disease which currently the standard of care has limitations, if you can add to that, they have a process in which they will expedite review of your data to get you a license to be able to sell your product in the marketplace. In other parts of the world, we don't really have that process yet, or we don't have that process in a formalized way. So, we're looking to work with governments and agencies to see whatever we can do to bring products to patients quickly, particularly if there's a significant unmet clinical need.
And that would sound to me to be an eminently sensible approach for regulators to take. You've been listening to Health Professional Radio with Wayne Buckler, and I've been in conversation with Gary Jankelowitz, the Medical Director for Australia and New Zealand with MSD. Gary, it's been fascinating to talk to you and get a little insight into what the future holds. Thank you very much for being available to us today.
Thank you, Wayne. It's been a pleasure.
Now, Gary, for people who want to get further information, is there a website that they can go to get in touch with you?
Yes, they can go to msd-australia.com.au.
So msd-australia.com.au is the best place to get further information. If you've missed my interview with Gary this morning, the good news is we have a transcript on our website. You can also listen to the audio archive both on YouTube and SoundCloud. The transcript is at www.hpr.fm. My name is Wayne Buckler. You're listening to Health Professional Radio.